Welcome to today's class. We are here to discuss about the anti-arrhythmic drug class 1, and in 1 the class 1B and 1C. We discussed the drugs of class 1A in the previous class. So, again just let us revise a little things from cardiac arrhythmias. Our normal heart beats from 60 to 100 beats per minute. If there is a less beats than 60, if it beats less than 60 times in a minute, it will be called as bradycardia. Whereas, if it beats more than 100 in a minute, then it will be called as tachycardia. So, these two things, and the next two things which also included in arrhythmias, that is fluttering and fibrillation. It can be atrial fluttering, atrial fibrillation to ventricular fluttering, ventricular fibrillation. What is fibrillation? When there is a irregular interval between the peaks of our normal heartbeat, like if it is the heartbeat, if it is the equal interval, then it is a normal heartbeat. If there is irregularity in between, that means if there is irregularity in between these peaks, then it will be called as fibrillation. And if there are some this type of peaks in between can be seen, then it will be called as fluttering. So, there is a difference between fluttering and fibrillation. Fluttering में equal interval में gap होगा, हर interval में आपके peaks के interval में equal gap होगा, जबकि fibrillation में equal gap नहीं होगा. Arrhythmia में ये दोनों चीज़ें भी हमें देखने को मिलती हैं, that is atrial and ventricle दोनों side में. So, cardiac arrhythmia results from alteration of the orderly sequence of depolarization, which is followed by repolarization, then plateau and then rapid repolarization. ये जितने भी sequence चलेंगे इसमें alteration हो सकता है, then it will be called as arrhythmia. It results in alteration of the heart rate and rhythm, which is arising from the single generation or conduction. That means conduction means we discussed already कि हमारा जो conduction है that is from starting from SA node, then it is going to AV node, then your then it goes into your next is bundle of His, then left and right bundle branches, and lastly to Purkinje fibers. Like this it travels, the conduction, the electric impulse, it travels like this. अगर यहाँ पे कुछ प्रॉब्लम होती है, that means SA नोड से आपका जो वेव है, जो इलेक्ट्रिकल इम्पल्स है वो चला, बट टाइमली AV नोड के पास नहीं पहुँचा, या AV नोड से टाइमली वो नेक्स्ट पोजीशन पे नहीं पहुँचा, then there is an abnormality, there is an irregularity, and this irregularity is called as arrhythmia. The same thing, the classification. Here we are going to discuss in this class about the 1B and 1C class. 1B is consisting of Lidocaine, Phenytoin, Tocainide and Mexiletine, the 4 drugs, the main 4 drugs of class 1B. And 1C is consisting of Encainide, Flecainide, Lorcainide, Moricizine and Propafenone. Few of them are included in our syllabus. So, the medicines, the drugs which are included in our syllabus, we are going to discuss those only. In the last class, I have told you that our cycle is the heart cycle, the conduction cycle is divided into 4 phases, that is phase 0, then phase 1, phase 2 and phase 3. Phase 0 is called as depolarization. Why I am again telling you this? So that we can relate to the 1B and 1C classes. Phase 0 is your depolarization, where sodium channels open and there is an intake of sodium ions from extracellular part to the intracellular part. Then phase 1, it will be called as repolarization, where the opened sodium channels, that means depolarization के time पे जो sodium channel आपके open हुए थे वो अब close हो जाएंगे and your potassium channels will open and there is a out of your potassium channels, that means potassium ions will move out from the cell. The third is your phase 2, that is called as plateau phase. It is a combination of phase 0 and phase 1, that means depolarization and repolarization. So, plateau has both the things, that means intake of sodium channels, at the same time out of potassium channels, and one more new thing is happening in this plateau phase, that is intake of calcium channels. This calcium basically helps in the conduction of your electrical impulse, further conduction of your electrical impulse in the cardiac system to make the heart pump strongly. Then the phase 3 comes, that is the last phase, also called as rapid repolarization, in which the incoming and outgoing of sodium channel, that is which was already inside, it is closed, then there is no further incoming of sodium ions and calcium ions, both the channels will be closed here, but potassium channel will be open, so that the extra potassium which is inside the cell will move out, and again it repeats the same thing, that means phase 0, phase 1, phase 2 and phase 3. So, normal conduction के लिए, हमारे हार्ट की normal conduction को देखने के लिए ये चारों phases बार बार होंगी, regular intervals पे होंगी, in some milliseconds, it requires some milliseconds to complete a cycle, तभी a phase, तभी हमारा जो cycle है 1 minute में, हमारा heart जो है वो 1 minute में 60 to 100 times beats करेगा. Otherwise, there will be problem, that means there will be tachycardia or bradycardia, fibrillation, fluttering, anything can happen if there is a problem in the conduction system, if there is a problem in the phases. So, let us come on the classification. So, class B, 1B and 1C. Again I told you in the next class that class 1A, 1B, 1C, all these are your sodium channel blockers. That means all of them will affect here in the phase 0, that is your depolarization. How, why they are different then? Why class A is different? If all are your sodium channel blockers, then why class A, class B, class C, like it, why it is differentiated in divided into 3 more parts? Because class 1A is your moderate sodium channel blocker. Also here it is written, it lengthens the refractory period. That is why class 1A is different. Class 1B, again sodium channel blockers, it shortens the duration of action potential. So, action potential, which is the conduction part, action potential decreases, this duration of action potential decreases, and 1B is also called as weak sodium channel blockers. And last, that is class 1C, sodium channel blockers again, where it is different? It is different in conduction slowed. It slows down the conduction of your heart beat, that means the phases 1, 2, 3, the conduction of the phases, the rhythm of the phases getting slowed down. So, these two basically mechanism of action is very little different, and these all are considered for working on phase 0, that is depolarization phase. So, let us start with discussing our class 1B. So, 1B there are 3 drugs which we have to study, that is lidocaine, mexiletine and phenytoin. These drugs, they increases the electrical threshold of ventricular excitation. I told you in the last class that there are, our heart has 4 chambers, or you can say 2 parts are there, 2 parts, that is atrium and ventricle. So, atrium again has 2 parts, left and right atrium, whereas ventricle again has 2 parts, left and right ventricle. So, here class 1B, it increases the electrical threshold of ventricular excitation, that means left or right, it can be any ventricle. Ventricular excitation during diastolic pressure, we know there are pressure, 2 types of pressure, systolic and diastolic. Systolic means the upper pressure, diastolic means the lower pressure. So, during diastole, it suppresses automation and diastolic depolarization, again it comes depolarization, the diastolic depolarization, and it reduces the refractive period duration. So, it basically works on the ventricular part where the excitation happens in the diastolic phase, and it suppresses the diastolic depolarization, and ultimately there is a reduction in duration of refractory period. So, it is different from class 1A because class 1A blocks the opened Na channels, that is sodium channels which has already opened, and class 1B what is doing? The sodium channels which was inactive, it blocks those also. That means class 1A was blocking the sodium channels which were opened, but class 1B blocks the sodium channels which are inactive now, so that they cannot be active in the next phase. So, it works like that. It is closing the, it works on the sodium channel only, but where sodium channels which are inactivated right now, so that they cannot be activated in the next phase or in the next cycle. This drug lidocaine, mexiletine, they act as local anesthetics also. They are used in anesthesia, local anesthesia they can be used. However, they are used for severe ventricular arrhythmias because that has an originate during myocardial infarction, surgical intervention. These are the conditions where we can use. The primary use of lidocaine, mexiletine is they act as local anesthetics, and at the same time where we are using it? We are using it, they can originate during in myocardial infarction, in surgical interventions, catheterization of the heart, and intoxication by cardiac glycosides. That means, it can be used in various types of problems, arrhythmias or related to our cardiac system. And phenytoin, which is not a local anesthetic, but we saw phenytoin in the different class, that is your anticonvulsants. Phenytoin is acts as anticonvulsant. This is the primary effect of phenytoin, and it is used as oral agent. Thus, it replaces lidocaine in paroxysmal tachycardia, which is caused by intoxication. So, the drugs which are used in class 1B, it is working in 2 different places. Already they are in 2 different places, and in conjugation or in alone as well, they are working for your cardiac, proper cardiac conduction of electrical impulses. Okay. Lidocaine, it is used generally as local anesthetic. Phenytoin generally used as anticonvulsant. Lidocaine and mexiletine both are used in cardiac functions, that is in myocardial infarction, surgical interventions, catheterization of heart, and intoxication by cardiac glycosides. Whereas, your phenytoin, which is used as anticonvulsant drug normally, which is here, which is used as replacing lidocaine in paroxysmal tachycardia, which is caused by intoxication. So, phenytoin is used where your lidocaine is cannot show its proper functioning. There we can use phenytoin. Let us discuss about the lidocaine. The duration of action potential is decreases here. Lidocaine, it has a lower action potential. It shows lower action potential, decreases the lower action potential, whereas it is used in ventricular arrhythmias and digitalis toxicity. We discussed in the last slide that they are used in intoxication by cardiac glycosides. If there is a use of cardiac glycoside happens, then there can be a chance of toxication. So, lidocaine is used in digitalis toxicity as well. This is the structure of lidocaine. So, let us discuss about the phenytoin. Phenytoin is originated, or originally it was introduced for controlling the convulsions. It is a CNS medicine, and but now it is showing very good effects in the treatment of cardiac arrhythmias as well. That is why we are using phenytoin. Lidocaine is replaced by phenytoin if there is intoxication by cardiac glycosides, heavy intoxication, then lidocaines are replaced by phenytoins. Their phenytoins are working very good. So, the use is in epileptic seizures, that is its normal general effect. Then in anesthesia again, we discussed in the last slide. Next is open heart surgery. In open heart surgery, phenytoin is used, and last is digitalized induced and atrial and ventricular arrhythmia in children. If there is toxicity caused by digitalis, that is again cardiac glycoside, caused by digitalis in atrial and ventricular arrhythmias in children, then your phenytoin is used. This is the structure of phenytoin. Let us discuss about the chemistry of phenytoin. The parenteral administration of phenytoin is usually limited to IV routes. Phenytoin for injection is dissolved in a highly alkaline vehicle. It is needed for proper administration of the drug and proper mixing of the drug with the vehicle. It is very mandatory to use highly alkaline vehicles for phenytoin. So, this is required because phenytoin is weakly acidic and very poor solubility in unionized form. That is why it is using higher grade, higher pH vehicles, that is alkaline vehicles. So, it has a poor solubility in the unionized form reportedly. However, its phosphate ester phosphenytoin, that means there is a derivative of phenytoin, that is phosphate estered phenytoin, that is called as phosphenytoin, has water solubility advantages over phenytoin for injections. IM is avoided because it settles down in the tissue and causes necrosis. What necrosis is? When there is a accumulation or settling of certain drugs at the point of injection where it is given, then there is a death or nearby death of the cells covering the injected area. So, there can be those cells nearby the injecting area can be affected very badly. That is why IM is avoided, IV is given. So, and the erratic absorption because of high alkalinity. It is having high alkalinity, so we cannot inject it in the muscles. Then the third drug, that is Mexiletine. It is similar to both, that is lidocaine and tocainide, in effects and therapeutic action. It is a local anesthesia, local anesthetic and active arrhythmic agent by oral route, chemically and pharmacologically similar to lidocaine. So, Mexiletine is again a drug we studied in the previous slides. We studied that Mexiletine and Lidocaine, they both are used as local anesthetics. So, almost they are having the same effect, same functions. It is same as Lidocaine and tokenide in effects and therapeutic action. It is used in active arrhythmias. It is given by oral route and it is pharmacologically similar to Lidocaine. So, where it can be used? Where Lidocaine is used, at the same place Mexiletine can also be used, like ventricular arrhythmias and congenital long QT syndrome. That is your PQRS wave, where there is a wave between Q point and T point, then it can be congenital, it is long QT syndrome, it can be Mexiletine can be used. Next, we are here for our 1C class, that is your flecainide, encainide, propafenone and moxazine. Again, I want to discuss that 1C is also sodium channel blocker, but it will be called as strong sodium channel blocker as the classification says. And if we go to that slide, in the classification slide, one more thing it is saying that your class 1C is it slows down the conduction. That means it is having a little different mechanism of action. It is definitely working on the sodium channels, but it is a little bit different than class 1A and 1B, that it is slowing down the conduction by acting on sodium channels and it blocks it. Class 1C. So, class 1C is again your sodium channel blockers. They substantially suppresses depolarization of myocardial cells while insignificantly reducing the time of their repolarization, and they also suppresses automatism of sinoatrial nodes. So, generally it suppresses the depolarization we discussed, because this is the mechanism of action of myocardial cells, while it insignificantly reduces the time of repolarization. That means the second phase, first phase was phase 0 was your depolarization and second phase was your repolarization, that is phase 1. So, what is doing? It reducing the time of repolarization, that is phase 1, and it also suppresses the automatism of sinoatrial nodes. That means the wave, the conduction, the electrical impulse which is traveling from SA node to AV node. साइनोएट्रियल नोड्स में जो आपका ऑटोमेशन हो रहा है, एक नया इम्पल्स जनरेट हो रहा है जो कि आपके एवी नोड में जाएगा, वहाँ पे भी ये इफेक्ट करेगा. सो these are the drugs which is basically working on the very first part of the conduction which is starting from SA node. वहीं पे जो आपके सोडियम चैनल्स हैं उनको ब्लॉक करके द कंडक्शन ऑफ योर सेकेंड फेज, दैट इज फेज 1, उसको थोड़ा सा स्लो डाउन करता है, सो दैट जो आपका कंडक्शन स्टार्ट हो रहा है फ्रॉम SA नोड, इट स्लोज डाउन अल्टीमेटली एंड द कंडक्शन ऑफ इट गोज स्मूथली. So, these drugs are used for preventing and regulating supraventricular tachycardias and atrial fibrillation in patients with normal or close to normal ventricular function as well as ventricular arrhythmias. So, I guess you people are knowing that what a fibrillation is, what a fluttering means, what is tachycardia, what is bradycardia, which phase shows what activity. That means phase 0 is showing depolarization, phase 1 is showing repolarization, phase 2 is your plateau. That means both the things, that means depolarization and repolarization occurs at the same time in plateau simultaneously, and phase 3, that is called as rapid repolarization happens. So, what we should know is in this class, the drugs of 1B and 1C are your sodium channel blockers, but a little different in their mechanism of action. We discussed it. Class 1C is different than class 1B and 1A. It is working on the sinoatrial nodes and it suppresses or reducing the time of your repolarization, that is your phase 1. So, these drugs are working like that only. Next, these are the references, again the same references. So, lastly I want to repeat, I want to discuss the things once again. One disease is seen, basically the drug Lidocaine. As you see here, there is a drug written Lidocaine in 1C only, which is not given in the syllabus of BPharm 5th semester medicinal chemistry, but we should know there is a syndrome which is related, which is basically treated by Lidocaine, that is called as your Wolff Parkinson's White syndrome. Your W Wolff Parkinson's White syndrome, WPW syndrome. What is happening in this? In this disease, there is an extra electrical pathway, an extra impulse is happening, is generating from upper to lower chambers, that means from atrium to ventricle. When the conduction of heartbeat happens from atria to ventricle, then there is one extra electrical impulse is generating, and this disease is called as, this syndrome is called as Wolff Parkinson's White syndrome, which is corrected by the drug Lidocaine. Okay. This is just for our knowledge that there is a syndrome in which there is an extra electrical impulse can be seen from upper and lower chambers, and it causes rapid heartbeats. Why it is bad for us? Because it is causing rapid heartbeats. So, to correct the syndrome, to decrease the effect of this type of heartbeat, Lidocaine medicine from class 1C is used. Okay. So, what we discussed, let us see once again that cardiac arrhythmias are the diseases in which 4 type of problems we can see: tachycardia, bradycardia, atrial fibrillation and ventricular fibrillation, atrial fluttering, ventricular fluttering and arrhythmias. Then the classification, we till now we discussed in this class, we discussed the 1B and 1C medicines with their mechanism of action, their name of the medicines and the uses of those medicines along with the structure, the chemistry of them, and this is the 1C class, that is flecainide, encainide, propafenone and moxazine. And these are the references. The references are same as last class, that for chemistry part Foe, synthesis of essential drugs and Berger is used, and for ecology part essential of medicinal pharmacology by KDT and pharmacology by Lippincott illustrated reviews is done. Thank you so much for this class.